We focus on the heart of the GLP-1 community. Real people, real stories, and the fight for affordable access. By listening, you are supporting our advocacy efforts to make these life-changing medications accessible to everyone who needs them. This isn't just a podcast, it's a movement. Welcome to the GLP-1 Collective.
Welcome to the GLP-1 Collective podcast, where we share real stories, real advocacy, and together we make a real impact. We're creating a community centered on support, education, and real change. And we are working hard to make affordable access a reality for everyone who needs it. Visit glp1collective.org to support our mission and learn more. Today's guest is a force of nature, vibrant, outspoken, and full of life. She's a passionate advocate for affordable access to GLP-1s, and you truly cannot talk to her without cracking a smile. In this conversation, we dive into her weight loss journey, her experience with Mochi Health, the looming FDA deadlines around compounded medications, and the rise of the GLP-1 gray market. Sarah brings energy, honesty, and heart, and I am so glad that we got to have this conversation. You have always seemed like such a fun personality, so I was really excited about the chance to hang.
Awesome. Yeah, I'm super excited too. So I think it's going to be a fun time.
So we started talking recently because of affordability issues with GLP-1s. And I am so curious to just dive right in there. How did you get started on GLP-1s? What issues have you run into financially?
Oh, girl. So honestly, my story mirrors a lot of other people's stories, thousands of other people's stories. So basically, 2021, I went to my primary care physician because I was just gaining weight like crazy and I just could not figure out why. Had a bunch of blood work done, and saw an endocrinologist, had them run a panel on me. Ended up, they're looking at my numbers and stuff, and they're like, oh, well, we think you have PCOS. And I was like, news to me. Here I am, 35, never heard this diagnosis a day in my life. Anyways, my primary care physician, I bless her heart, she's like, well, there's this new medication called Saxenda that is for weight loss, and I have some samples here, so you want to try it? And I was like, sure. And I really appreciated her trying with me because, she wanted to help me lose weight, but she never explained that it was a GLP-1 medication. I had no idea what this was. She never explained to me that these initial doses that I may not feel anything. I don't think she really knew. I think the drug reps just came in and here's some samples. Give them out to your patients. Give them out to your fat patients. Anyways. And so I did that for a month and I didn't lose any weight. And I was like, okay, this isn't working. And then we went the phentermine route. And I'm sure a lot of people have experience with phentermine. And it was like, whoa, here we go. I'm wrapped up. And mood swings were crazy, highest of highs. And then 2 seconds later, I'm like, oh, I'm sad. And so I was like, oh, I don't like this feeling. And then went back to my primary care physician. She's like, well, there's this new drug called Ozempic that you might want to try. And then again, she didn't explain that it was a GLP-1, that what it would do, how, how it affects your body and things like that. So I took the very first initial dose of Ozempic, and again, it didn't do anything for me. And I was like, this ain't working. And so I kind of just abandoned that. And then I was just trying my best to manage with diet and exercise. And literally I was weighing out every single thing on a food scale. I was doing CrossFit. I was running half marathons. I've always been super active. And then TikTok started blowing up around 2021, 2022. And that's where I started learning about GLP-1s and what they are, how they affect your body, and how they come into play for people with chronic obesity. And I was like, oh my gosh, I need this medication. And it's so funny because I always check my memories that pop up, and I think it was 4 years ago, I saved a screenshot of the Wikipedia page for semaglutide. And that's what kind of got me started on it, and really trying to figure out what these medications were, how it can help with obesity. End of 2022 is when Manjaro came out on the scene. And I was one of those very lucky folk that downloaded that original savings coupon. Didn't matter insurance coverage or anything. It was going to be $25. And so, yeah, I was so lucky that I downloaded that coupon and I was able to hop on the Manjaro train end of 2022. And I literally rode that coupon until it fell off in June of 23. Honestly, the TikTok community is how I really learned about GLP-1 medications. Dr. Myra and Dr. Jenna were one of the very first people that I followed on TikTok that really discussed the science behind it, what these medications are doing, and how it can help. And so I started with them. And then, like I said, I was on Manjaro and I was documenting my journey with Manjaro and those savings card issues. I remember one time I spent 3 hours in a Walgreens for them trying to get that savings card to work. Like, that's how desperate I was
my
for them.
gosh.
I spent 3 hours with them calling the Eli Lilly savings card hotline, giving the phone to the pharmacy tech. And I ended up walking out without the medication because they couldn't get it to work. I was almost in tears. And then I rode that coupon until it ended in June of 2023. My primary care physician, she really, really tried. I think she was really, really overwhelmed and she tried to submit a lot of prior authorizations for me. We did an initial prior authorization. I submitted blood work, all my panels to my insurance, and then they denied me. I ended up kind of like escalating it to appeal, and then a third party appeal. And it never worked because my insurance just would not cover it. Also, speaking about Manjaro, the shortages, when it came time for my refill, like I was calling every pharmacy in like a 75-mile radius to see if they even had it in stock. My story is not unique. This happened to so many people. I just remember just like the anxiety and the stress around it of just trying to see if anybody even had it in stock. If they didn't have it in stock, what next dose below or above did they have in stock? And anyways, in July of 2023, I ended up, kind of just being lost. Like, I was like, I don't even know what to do. Like, I don't have coverage for this medication. All my appeals are being denied. I can't afford $1,200 out of pocket every month. And then that's when compounds were starting to come about. And they're like, yeah, you can get compounded semaglutide, compounded tirzepatide. And when they first started coming around, like, it wasn't really affordable to me. A lot of the telehealths were offering like $400 a month. I was still kind of like out of my price range. And then eventually they were able to come down with the price ranges. And then I ended up joining a telehealth. And honestly, it has been life changing.
When Compound first became available, were you hesitant at all? Were you afraid of there being safety risks?
No, like I said, Dr. Myra was one of the very first initial ones that I found on TikTok about GLP-1s. And when she, mentioned that compounds were a great alternative for us, I was like, I trust her. And then just seeing a lot of other people, like I was just searching compounded semaglutide, compound tirzepatide on TikTok, and just seeing all these other folks that were doing it. And, they were losing weight and they weren't keeling over. So I was like, you know what? If it's safe for them, it's safe for me.
Yeah, I feel the same way. I was hesitant for the medication in general, but then once I got over that nervous hump, I was like, Compound seems fine. Everybody's still alive and thriving.
Yeah, they're not growing tails or anything. I think we're fine. And like I've never really been fearful of trying different things. And honestly, like I was just so desperate to lose weight. I was like, I'm just gonna try it. Like, hello, I was doing phentermine, which is basically legal speed. So I was like, if I could do phentermine, I could do this.
Well, I'm glad that you made it out of that alive.
Me too.
Without an addiction.
Oh my gosh, I'll never forget though. This is a funny phentermine story. I remember because I was doing CrossFit, right? When I was taking it. Before I would go to CrossFit, I would do pre-workout. So I forgot that morning I took my phentermine, and then right before CrossFit in the afternoon, I took a pre-workout. Girl, I didn't sleep for 36 hours.
Oh
I was
my
fully
gosh.
awake. And I messaged my doctor and I was like, doc, I haven't slept in 36 hours. Am I okay? And she's like, please stop taking pre-workout.
Yeah, probably not good to take together.
Yeah. That was I'll never forget that. I just remember laying in bed, like awake, like with my eyes like this, like, oh my God.
A lot of people say that they get insomnia on a
Mhm.
GLP-1. Have you had that experience at all?
This is so funny because when I was on Manjaro, the name brand, I did get insomnia. I probably wouldn't fall asleep because I wake up at 4:30. When I was on name brand Manjaro, I would have a hard time falling asleep. sleep, but I would able to fall asleep around 11 o'clock. But on the compound, I have no issues with insomnia at all. My bedtime is like 8:39. I'm asleep by 9.
And you were active previously on a GLP-1. Are you still active?
Oh, girl, yes. And it's nice because like prior to being on a GLP-1, when I would work out, like I said, I was doing CrossFit. I was training for a half marathon. I would be killing myself doing these grueling workouts and seeing no result. The wonderful thing about being on a GLP-1 is I'm working out and I'm seeing results. I have muscle definition. Like I got a lot of loose skin, but I got abs under there now. It is insane to see the fruits of my labor, to know that my workouts are like paying off. It just keeps me going. I work out 5 days a week.
Jeez, that's wonderful. You don't feel like your cardio has gone down at all? I know that some people who are athletic prior to starting sometimes feel like they don't have as much output.
I don't know because I'm not training for anything right now. I did do a marathon relay last year while I was on a GLP-1, and I had no issues. I had no trouble with my output or anything like that. But right now, I don't think so. Like, I'm able to go, and my cardio is actually pretty good, I think.
Being lighter definitely helps.
Yeah, that's the thing now. Like before, like when I would do a run, even if I was running 2 miles, I would swell up. My hands would be so swollen, I could not take my rings off. But now I can run for miles and like I could still take my rings off. I am not swollen. My knees don't hurt. That's the biggest thing. I love, like, my knees do not hurt anymore. Like my inflammation is gone.
If I was doing long distance, I would have to hold my hands up like
Yeah.
this. I'm not even kidding you, because my hands
Yeah,
would
like-
get so swollen. I'd be jogging like this.
Yeah, it's crazy, but I did a 5K a couple weekends ago and I ran the whole thing. One of my best times I've ever done. And it was mostly uphill too, which is crazy. And I didn't swell after. My knees didn't hurt. It was a very wonderful experience.
Do you have anyone that you work out with?
No, I usually work out by myself. I work out at home. I'm a home workout person. I have all my equipment here. I'm in an apartment too, by the way. I have my own little space that I just make do with. And I like working out at home. I don't miss the gym, really.
Me either. It's so nice to just wake up and get your coffee and go right to it.
It is. Like, I don't have to get in the car. I don't have to worry about battling the weather. It's nice.
Or the extra time it takes just to drive there or get ready to actually go out in public.
Yeah, especially since I'm a morning workout person, I have slotted myself enough time to wake up, get dressed, go in the living room, go do my workout, and then get ready for work.
Do you have people in your life that know that you're on a GLP-1?
I'm loud and proud about it. I've always been super, super transparent. I started my weight loss journey, honestly, 11 years ago when I had weight loss surgery. And I've always been very vocal about having surgery and utilizing that tool. To me, being open and being vocal about the means that you're doing to lose the weight, I think this is what's going to break down the stigmas behind this. Because if we keep it secret, it feels like it's a kind of a shameful thing. But if I'm loud and I'm proud and I'm like telling you this is what I'm doing, people are gonna be like, oh, well, that's a great tool. And so anybody that asks me, Sarah, what are you doing to lose weight? I'm always open with them, like, hey, I've had this surgery. I'm also on a GLP-1 medication. These are the tools that I'm using to lose the weight. At work, I work in an office building with a few hundred people, and they start noticing. They're like, well, what are you doing? And then I'm like, oh, well, I'm on this medication and it's been amazing. And this is how it's helped with X, Y, and Z with me. And I've had coworkers sign up for GLP-1 medications through telehealth through me because they're like, oh my gosh, if it works for her, it might work for me.
I have heard this before. There are a lot of people who do it secretly and they don't want people to know. And you're right. I think that that encourages a shameful stigma. But I also understand feeling like you just do not want people to know. It's none of their business. And it feels really icky when people impose their opinions on you. Have you had that
I don't
experience?
care. Bring it on. Bring your opinion on, because I will debate you till I am blue in the face about why this medication is amazing. Because I'm comfortable in my choices and my decisions. This is the hill I'm willing to die on. I'm very proud of it. I'm very proud that I've taken charge of my health because I've been obese since childhood, and this has been such a hard battle. And I'm like, I wish this medication was around when I was a kid, honestly.
Have you had people in your life off of the internet? Because I know that people are very vocal on the internet.
Oh, girl, yeah.
Coworkers that have nasty opinions about GLP-1s or people who have actually been combative.
No, not at
fantastic.
all. No. Yeah, I'm very, very lucky. Like, I think it's just showing them that, just because I'm on this medication doesn't mean like I'm literally sitting on the couch rotting away eating 5 chips a day. No, like I'm showing them like, okay, I'm working out. I'm very active. I eat my 6 small meals a day. I try and eat as healthy as possible, but I also am a human. Like I enjoy different things. Like today we had a potluck at work. I had a cupcake. Oh, so nobody in my personal life in real life has ever said anything negative about it.
I think it's probably difficult to have something negative to say when they're talking to such a positive person. You
I
just
think
seem
so.
genuinely so positive. Like, I could not be mean to you.
Thank you. I think that's probably why, because I try and radiate what I want to receive back. When you do good, you get good. And I think that's probably why I haven't really had any negativity towards it. And if there has been any negative opinions, I haven't heard it.
Tell me, have you had any issues with the FDA cutting off access to compound medications?
So luckily with the telehealth that I am with, they have repeated it just because the FDA took the compounded medications off the shortage list, they're not stopping. And so luckily I have not seen any kind of disruption in my medication. So no, for right now, but who knows what can happen in the future. And it's kind of scary, but I've been with my telehealth for 16 months now and I've had amazing service. I've never had any kind of trouble. So I'm hoping their plans are continuing on and hopefully, I'm still able to get my medication down the road.
Can I ask, are you with Mochi Health?
I am.
You
Yeah.
said Dr. Myra, and I knew right
Yes.
away because I have heard so many positive things about her. Everyone who uses Mochi, I swear, has just had the most fantastic experience with her and is very loyal.
It was her and Dr. Jenna. They paved the path for GLP-1s on the TikTok space. And like I said, I love TikTok. I'm very, very thankful for TikTok because if it hadn't been for TikTok, I don't know where I would be as far as my health journey. When Dr. Myra started Mochi, I was like, oh my gosh, this is a great viable option for me. And luckily for me, they take FSA or HSA. And so once January rolled around in 2024, I loaded up my FSA card and I was like, signing up for Mochi, let's go. And honestly, it's been wonderful since. And I've met some great friends through it too.
I'm glad that you have that. And I agree. TikTok's made it so easy for people to feel connected and less lonely in their journeys and to be able to learn how to manage side effects. Speaking of, do you have any side effects? I mean, you've been on it for a while now, so I'm curious where you're at now.
I'm a freak of nature and I feel like, I don't know if I have an iron stomach or what. So like, I'm very, very lucky. I have no negative side effects. However, this is my caveat, injection site. So I've always either done my arm or my stomach for my injection site. The other week, I was like, you know what? For shits and giggles, I've never done my thigh. So let me try my thigh. My thigh has been the injection site that gives me nausea. And so for the first time ever being on a GLP-1, I started getting nauseous. I was like, oh, so this is the nausea that people are talking about. Luckily, it was mild. I think, I would just sip on a protein shake and I would feel okay. I think it was last weekend. We got Wingstop and I love Wingstop. I think I ate 2 wings and I was like, I can't. Oh, just thinking about it, it makes me want to throw up. But other than that, that's like the only side effect that I've had being on this medication besides weight loss and, finally being healthy.
Okay, but your hair. Have you had any hair loss?
I haven't.
Wow.
And this is just me forming a half-assed hypothesis. So when I had my weight loss surgery, I did lose a lot of hair. I lost probably about half of my hair, and then eventually it grew back, but it's not as thick as it once was. I used to have super thick Italian hair. And then when I had my weight loss surgery, now it's like a normal thickness. And then when I started the GLP-1 medications, I am a very slow loser too. So I think with the slower weight loss and then, maybe having lost my hair before, I haven't lost any hair and I'm very, very fortunate.
So you had bariatric surgery?
Yes.
And did that work for your weight loss initially or in general?
It did. So I had bariatric surgery 2014. I lost 160 pounds, but then that was right when I met my husband. And so, you gain happy relationship weight. And so over the course of a few years, I probably maintained most of the bulk majority of my weight loss the first 5 years of being post-op. And then around year 6 is when I started gaining weight. But that's when that PCOS really kicked into high gear and my A1C was getting up there and my doctor's like, something ain't right here. And then I went to the endocrinologist and she's like, yeah, judging by your levels here of your labs and the, the excess weight gain and also the excess facial hair, they're like, she's like, I'm pretty sure you have PCOS. And I was like, yeah, I think so. So that is when I started really like gaining weight like crazy. And after my surgery, I regained almost 70 pounds out of the 160 that I lost.
For anybody listening who does not know what PCOS is, would you mind explaining how that affects weight gain or the inability to lose weight?
Yeah, so PCOS, polycystic ovarian syndrome, and honestly, it varies person to person. I feel like my case is pretty mild, but also I don't know a lot about my own personal case because it was some lab work and then her just looking at my levels, and I've never had like an ultrasound or anything on my ovaries to actually determine that because I've never, been pregnant. But it basically makes it a lot harder for women to lose weight. It also inhibits the way that we process our food and how we store our fats and our insulin levels.
Is there specific food that you're supposed to avoid? I've heard when you have PCOS, don't eat like spinach, like certain healthy things. And I'm wondering
I
if
haven't heard that. I
no,
always hear
okay.
like if you have PCOS, you need to be on a low carb or keto diet.
Mm.
And that doesn't jive with me. I need some bread. I need some potatoes. I enjoy a pasta every now and then. And that's the wonderful thing about being on this medication is I'm able to eat the things that I like to eat. And obviously it's in moderation. And so I'm eating an actual serving size now instead of 3 serving sizes. I don't restrict myself on things that I can and can't eat. There is no in my vocabulary when it comes to foods.
You said that you're married.
Yeah.
How does your husband feel about your journey? Has he been super supportive?
Oh, he is. Yes. My husband's actually a bariatric patient himself. That's how we met, was through the bariatric community on Facebook. Anything that I've wanted to do to lose weight, he's always encouraged it. We always budget the money out of our budget every month for my medication. And he's super happy for me. He's so proud of me. So funny. Like we were on a cabin trip a couple of months ago and he's like, look, everybody. He pulled up my TikTok. He's like, look, my wife has 4,000 TikTok followers, you guys. And he made everybody do a cheers to me. And I was like, oh my gosh, you are so cheesy, but I love you.
It's so sweet. What a
Yeah.
sweet husband.
Yeah.
Oh, well, good. I'm glad that you have such a great support system. It must be really nice to be able to relate with your husband. Like he totally gets it. You guys
Yeah,
have both
he
had
does.
the surgery. And is it okay for me to ask, has he been able to maintain or lose weight with his surgery?
So with him, no, he did regain some weight and he did explore the GLP-1 medication, but he just didn't end up liking it. And I don't know whether it's because it made him feel crummy. I don't know why, but he's like, I don't want to do this anymore. I was like, okay, then don't do it. And his own weight journey is going to be his. If he ever wants to come to a point where he wants to explore GLP-1s again, I'm like, hell yeah, let's go. And if he doesn't, then that's fine. Like I love him the way he is. I didn't marry him for, whatever he weighs.
I'm super curious. If you met him in the bariatric community, then you probably know quite a few other people who have had bariatric surgery. Have you seen an influx of people who regain weight after bariatric surgery, like 3 to 5 years later?
Oh yeah. Oh yeah. This is very, very common because I built my platform on Instagram in the bariatric community. And it's funny because I think around COVID is when a lot of us were struggling with this regain. And then you start seeing people pop up like, oh, they're looking a little thinner. They're looking a little thinner. And it ended up being that they were on a GLP-1, but they're not as vocal about it. Like me, I'm like, hey, everybody on Instagram, I'm trying Manjaro. Let's go. And then it ends up coming out that they, were using a GLP-1. I think about this all the time. Had a GLP-1 medication been around in 2014, like would I have gone through with the surgery or would I have gone the GLP-1 route? Oh, maybe not. Maybe I wouldn't have had the surgery. Maybe I just would have gone with the GLP-1. And luckily for me, my surgery went well. I had 0 complications. The only complications I do have now is I have pretty severe acid reflux and I have to take a medication every day for it. I think about that all the time. And when I had my surgery, I had no support as far as a dietitian support or a doctor's support after. Yeah, with Mochi, I get my doctor, I get a dietitian, and I also have a mental health therapist. And I was talking to my therapist through Mochi, and I was like, yeah, When I was post-op from surgery, I literally had my 1 week checkup and that's it. They didn't check on me at all. And they didn't hook me up with any nutrition classes or nothing. He's like, girl, what? And I was like, I know. And then he's like, well, I'm so glad that you're here and you have this whole support system. I was like, me too, honestly. And it's funny because when I joined Mochi, I was like, oh, a dietitian? I kind of know everything already, so I don't need to see a dietitian. And then here I am making appointments with her just to talk to her about what I ate for the day. I use her all the time.
With Mochi, do you get all of that as like a package deal?
So yes, with a membership that I'm enrolled in, it's called their Wellness Plus plan, and that includes your doctor, your dietitian, and a mental health therapist.
You said you have to budget. Do you have to make lifestyle changes to be able to afford this medication?
I honestly don't because I pay with my FSA card that I get through work.
What does that mean?
So FSA is a flexible spending account that is offered through your benefits through your employers if your employer does offer either an FSA, a flexible spending account, or an HSA, a health savings account. And Mochi accepts those types of payments. So basically what an FSA card is, it's a debit card that's preloaded at the beginning of your calendar year with however much you elect. So like for me, I elected like $2,000 to be loaded onto the card. And then that $2,000 is then evenly deducted from my paycheck every pay period.
Gosh, that makes it easy to save.
Yes. Whenever I go to pay for my refill for my medication, it just gets charged to my FSA card. I don't see it come out of my bank account, which is kind of nice. I know I'm paying for it because it is coming out of my paycheck, but it's not coming out of like my
It's
bank
not front of mind.
Yes, exactly. It's really nice because like I said, you can use your FSA card to purchase Band-Aids, tampons, aspirin, whatever you need for your medical. You could use it for your office copays and stuff, which is nice. But it's nice that Mochi accepts those payments.
I did not know any of that, so thank you.
Yeah, it makes it super accessible. I always tell everybody around the October, November time, hey guys, if you're interested in joining a telehealth that accepts FSA or HSA, now's the time because open enrollment is coming soon. Make sure and select that on your open enrollment plans.
Can I ask if you have stockpiled at all to prepare just in case?
Not really. No, I haven't. I did order when Mochi offered the 3-month option for a supply. I did opt for the 3-month supply and I still have 2 months left, but I haven't stockpiled. No. And I know a lot of people do that. And I know that there's ways to do it. I just haven't done it. Maybe because I don't feel like compounding is going anywhere. I feel secure. So I'm like, okay, I'm fine. I don't need to.
I'm sure that you've heard about some of the drama with Mochi recently.
Yeah.
And
I pronounce it Akita, but a lot of people Equita. Yeah. However, and yeah, it sucks what happens, but it's just a snag.
I was going to ask if you feel like Mochi has been under fire from
Oh yeah, for sure.
Big Pharma or the FDA.
Girl, yes. I feel like that 100% was because Mochi has been top dog in the compounding game for so long because it's honestly affordable. It's very, very affordable. And since they had, a bulk majority of the compounding clientele, they're like, let's go after them. So, but like I said, I haven't stopped receiving great quality care from them. They've honestly have worked their asses off to shift thousands and thousands of patients to new pharmacies. And, like I said, it's just a snag in the pharmacies right now, but things are starting to work out. I don't doubt them. Like I've received wonderful quality care from them. A lot of people were like, oh my gosh, I'm requesting a refund. It's taken so long. And I'm like, if you had to enter tens of thousands of patients manually by hand, it's going to take a while. People aren't patient, and I get it. I'm a very impatient person myself, and especially when it comes to medication that you're paying for, of course. And I really feel like a lot of other telehealths are taking advantage of the hit that Mochi was taking to snag up other people, which honestly, great for them, make your bag, do it. But I don't plan on switching. Like I said, I've received great care from them. And honestly, I love my doctor and my dietitian. My doctor has worked with bariatric patients for over 25 years. So she knows what she needs to look for when it comes to my labs, because I get lab work done all the time and I upload my labs to her. And she's like, oh my gosh, your labs look so much better than last year. And so I don't want to switch because the providers that I have are amazing.
I absolutely get that. I don't have a great support system with my doctor.
It sucks.
I digress. I don't have that support network. So that sounds fantastic.
Oh, I know, especially like, being obese like my whole life. I dreaded going to the doctor because the first thing they're gonna tell you is lose weight. Going to the doctor becomes like a PTSD moment where you're like, oh, I don't want to get on that table and hear the table creak underneath my weight. Seeing the doctor was never a fun thing for me, but now that I'm healthy and my lab work is perfect, going to the doctor is great now, and I enjoy visiting with my doctor.
Two things that are kind of heavy. One, if something happens, let's say Mochi gets sued and they can't continue producing and prescribing this medication. Do you have a backup plan? What do you think you would do in that case?
If Mochi were to go out of business, I mean, there's other wonderful telehealths that I would go with. And then if any other telehealths weren't able to prescribe compounded medication, I honestly do not have a backup plan. I know there's peptides out there, and I know that there are people that are utilizing peptides and have been utilizing it for a significant amount of time and are doing great on it. I myself am not educated enough on this yet. But that probably would be the avenue that I explore, because honestly, Eli Lilly with your $600 a month vials, absolutely not. I cannot afford that.
Yeah, most
No.
people can't. Most
No.
people can't. And the entry level, they do have a deal on it right now. I think it's $350 for 2.5.
For entry level, but most of us are not entry level. Like most of us are at that 12.5, 15 dose,
Exactly. That is just enough to get people hooked. They try the
Yes.
medication, they realize how life-changing it is. Oh my gosh, the food noise is gone. Oh my gosh, my inflammation is gone. I feel amazing. I'm seeing the fruits of my labor, like you said. And then it's $500 next month.
Exactly. That's a car payment. Medication, car payment, putting food on my table. Like, that's crazy to me. Like you said, if compounding were to go, that Eli Lilly vials, it's not on the table for me, unfortunately.
Someone asked me recently in support group, and I was really grateful that they did ask. They said, should I be buying direct from the manufacturer? Because I don't want to feel like I'm betraying the movement, because they are overpricing everyone and it's not right.
Oh,
And
no.
should I do Lilly Direct? Would that be bad? Would that be like going against all of the work that we've done to advocate? And I'm like, I'm so glad you brought this up, because no, girl, you need your medication.
Yeah.
And it doesn't matter where you get it from. I don't care if you're getting it from the manufacturers. If you are, I think that's fantastic, as long as you're getting it in a safe way and a way that you can keep getting it. You need your medication.
Yeah, exactly. No, yeah. If they're able to afford it, absolutely do it, because I'm sure it's stress free and better than trying to research peptides and reconstitute.
And that was the other question I had for you that was really heavy. Yeah. Have you seen an increase in the amount of people using research and going gray since the FDA crackdown on compounding?
Yes, a lot of people. And I will say, I saw somebody on TikTok that went gray, and she reconstituted it herself, but ended up injecting herself with 4 times the normal dosage, and she was so sick. And I was like, see, this is why I'm not a mathematician, and I'm not trying to reconstitute this stuff myself. And my heart went out to her, because she had to go this route because with the crackdown on the compounds and the affordability and stuff, and so she had to go gray, and she ended up doing 4 times the normal dose, and I felt so bad for her. I was like, oh my God, I wish I could hug you right now, you poor thing.
I'm really glad that we're talking about this, because I've seen this more than once on Reddit. And I've also spoken with a pharmaceutical company that said that they were asked to make pre-filled syringes because people were misdosing themselves. And I asked them, do you think that it's because they're using research or going gray, mixing it themselves, and they don't know what they're doing? They don't have a doctor that's taking care of them. They don't have a support network. They have no information. And she said, I can't speak to that. I have no idea. I've heard the FDA speaking about how unsafe compound pharmacies are. And I truly do not know if they're talking about research gray or actual compound medication. I don't think there's any proof as to which one they even are talking
There
about.
probably is no distinguishment between the two. Honestly, they're probably pulling figures that include this research grade gray peptides that people are doing. And
Right.
it's probably skewing it in you know whose favor.
And when you go to the hospital, a lot of the time when these people are going to the hospital, because you can definitely get hospitalized with doing 4 times the amount of
Yes.
one of these medications, it is very dangerous and can be life-threatening. When you go to the hospital, I don't think a lot of people are just outright saying, bought this from China on the gray web.
Yeah.
And
No.
and I did this myself. Whoops. You know what I mean? Like most people will be worried about the law.
Yeah. And even if they did say, oh, you know, I injected this peptide, this GLP-1 peptide, who knows if the nurse is documenting it in their chart as patient injected research grade peptides, not from a compounding pharmacy. I highly doubt that is being charted in their chart.
Well, and I can tell you my personal doctor has me in her prescription database on Zepbound and I am on compound. They don't even have the option for compound. So again, if someone goes to the hospital and they say they're doing research grade peptides, there's probably very likely not something in the database for that.
Probably not.
I'm super curious what the actual data is, and I don't think that we will ever actually truly know. There's not a way to track that. So how do you feel about gray and research grade peptides within the community with the influx of people that are using it right now?
It's a little scary, honestly. For me personally, like I said, I am not educated enough to feel comfortable with doing it myself. I feel like this is something that you really, really, really need to look into. And then also, like, where is this coming from? From China? What actually is this? Is this really tirzepatide? Is this really semaglutide or whatever peptide you're supposedly purchasing? Like, I don't know. Like, it's a little scary to me. I would much rather stick with my compounds that I get from my 503A or B pharmacy, and that I know that works well for me, and I am still alive 16 months later.
My heart is filled with so much compassion for these people. I feel so incredibly bad for them. What more proof do you need that there is a severe issue when the FDA is pushing people to less safe choices with the pretense that it is for safety purposes?
This is all they're going to do, is just push people to explore dangerous avenues.
Yeah, and they already have.
Yeah, and it's happening, and we're going to be seeing. I just see now some headlines: so and so dies from tirzepatide peptide.
They're gonna say compound. They're gonna say compound.
Yeah, they're probably are going to say compound just to be jerks. Yeah, so I can see it happening, and I really feel like something like that is we're going to be seeing some headlines soon.
I genuinely believe that there are some wellness clinics and compound pharmacies out there that have not been up to snuff or doing everything by the book like they're supposed to. But the vast majority have historically, with multiple medications over decades, been sterile and effective. So the war on compound is disturbing because it's cutting people off.
It's so frustrating. I just wish like I can shake them by the collar and be like, what are you guys doing? I'm sure you guys are still making money hand over fist right now with people that are able to get insurance approval for this medication. So why are you going after us small fries on the compounds? Leave us alone.
A lot of people who are on the name brand medication, they don't have the support system that you do.
I have a whole team. I have my doctor, and I have my dietitian, and I have my therapist. I literally have a whole support system right there in my little portal, and I can go in there, go make appointments, super easy and quick. Because when I started this medication, I was like, okay, you know, I really want to see a mental health therapist because, you know, I just want to make sure I am doing right by myself and giving myself the best foot forward on this journey. And so, like, I did start the process of trying to find a therapist that was in network for my insurance. That's a whole chore. Like, I work 40 hours a week. You know, I'm a wife, I'm a mom, and it's a lot. And so, like, when Mochi rolled out their new wellness plan that included a therapist, I was like, oh my God, sign me up. Thank you for taking that off my plate.
And they specialize in GLP-1s because you would have to go do the research. You'd have to find a therapist that actually knows what they're talking about, preferably has experience, because again, a lot of healthcare practitioners do not really know very much about GLP-1s, except that you can use them to lose weight.
Yep, pretty much.
And you didn't have to do the research and spend separate money on a dietitian and a therapist and all of the above. I know that there are a few different telehealth companies that are doing that. My hope is to fill out our GLP-1 services locator so that people can find all of those services more easily when they don't have a package deal like you do.
It's really, really convenient. Like I said, it's absolutely worth the money.
Yeah, I could see that. So if you had no ability to get this medication ever again in general, let's say that something terrible happens and the FDA says it's no longer approved in general and we just cannot get it. What do you think would happen to
Oh
people in
God,
general?
to
I mean,
people in general, like honestly, like there's gonna be some people that it would probably throw them off the deep end. Honestly, like I could see people going into severe depressions, possibly ending their lives over it because this medication is so life changing. And I've seen people that it helps manage their depression and it helps manage their cravings for alcohol and stuff. So like this medication is more than just weight loss. It has helped in so many different ways. I feel like if this medication were to go away, it would be a very, very tragic thing because a lot of people would be just devastated by it. It'd be devastating physically and mentally. Like people would just be devastated.
I agree. I don't know that there's another medication, at least that I'm aware of, where people have been so desperate to be able to stay on it.
That's
other
what I'm
than
saying.
like
Like,
drugs that people abuse, because you don't get high off of this.
No.
It does the opposite. It literally makes you not want to get high.
Yeah, it helps you not turn to your dopamine seeking substances, alcohol, drugs, cigarettes, what have you. And so, yeah, like I can't think of any other medication that has had such a profound effect to where people are turning to little back alley sketchy ways to get it.
Yeah, and it's blowing up. So I'm hoping that the FDA will recognize it as a public health crisis. When people lose access to this medication, it is a public health crisis when thousands of people are cut off because obesity kills. And like you said, I would not be surprised if people started self-harming from depression coming back, from the inability to control themselves, from addictions that they had finally been free from. That wouldn't surprise me at all. But that is the first time I've thought about it. So
I know, me too. I was like, well, gosh, like with some people are so desperate to have this. Like I could see something like that happening.
Well, I cannot thank you enough for being such a joy and
Thank
a
you.
loud advocate. Tell everyone the good news.
That absolutely, that is me. I am loud. I am proud. I am very, like I said, this medication has changed my life for the better, and I will shout it from the rooftops to anybody that will listen. Like I said, my social media has always been a place for me to express myself and to just share like how I'm able to better myself and better my life. And if I can do it, you can do it. And so I will always be an advocate and be very, very vocal.
Thank you so much, Sarah. You're the absolute best.
Thank you, Amanda.
It's been fun to hang with.
Thank you so much. I appreciate it. Thank you so much. And it's nice to finally chat with you.
Welcome to the GLP.
This episode meant something to you. Help us keep it going. Leave a 5-star review or a comment to help other people find us. We can't help people if they don't know we're here. And we are so grateful that you are.